In case you haven't heard, America's medical industry is pretty effed, but it doesn't have to be. Welcome to wRight to the Root. I'm your host, Stephanie Wright, and I've built my career on helping practices reach their full potential. Join us as we dig down to the root of the insurance industry's most complex problems and how we might be able to turn it all around. So today on Right to the Root, we have a very special guest. He's unique because he is a dentist and he's also an attorney that specializes in healthcare. And I've invited Jake on because we've worked together with mutual clients here in the last few years. And I trust him with everything that he brings to me and his expertise on this. And so I had reached out to him because there's this mystery and cloud above antitrust laws that patients don't know anything about and doctors kind of vaguely know and they're just scared of. So I'm going to let Jake take it from here and tell us a bit more about yourself and your journey through getting into healthcare law and antitrust.
Sure. Absolutely. Thanks, Stephanie, for having me on. I really appreciate it quite a bit. I was a dentist first. I practiced for 5 years. It was a passion of mine, and due to some medical issues, I was forced to step away and landed on my feet on the legal side of healthcare. And primarily, my practice is representing doctors, their businesses for almost anything they need except litigation. As a lawyer with a focus on healthcare, I work closely with doctors and providers, so I have quite a bit of insight into the industry's regulatory landscape. There's several antitrust implications that are relevant to my clients.
Absolutely. It's so great to have that dual expertise on both sides. It's another reason why I trust you so much with my clients. And when I asked you to talk about antitrust, this is something that you studied extensively as you became an attorney, correct? All right. So tell me, what's antitrust?
Antitrust law consists of a body of regulations designed to promote fair competition and prevent anti-competitive business practices that could restrain trade or lead to monopolies. So the goal is to have efficient markets to give consumers access to a variety of goods and services at competitive prices. So in general, consumers benefit from more choices in the marketplace. Competition typically leads to better pricing, better products and services, enhanced innovation because companies are striving to gain a competitive edge. So, in general, all very good things. And as they apply or sometimes don't apply to healthcare, really they are important because they're going to directly affect our consumer well being. And we want more choices. We want better access to care. We want competitive pricing. And so the US is spending a significant amount of money. I think it's 5 trillion a year, and we still have issues with affordability, access to care. So what is the marketplace like? Why is healthcare like this? And it's quite unique in that the regulations sort of replace traditional market forces that move it away from a competitive market. So you compare it to the soda industry or the pop industry, whatever you call it. You go to the gas station, you find several countless soda brands that are pretty similar, and big differences are really the marketing. Prices are clearly displayed. You can compare them quite easily. If Coca-Cola is not available, there's plenty of alternatives. In contrast, with healthcare, you have fewer providers. States regulate the number of doctors through licensing, and many of the providers specialize in specific services. So in healthcare, pricing is also not as transparent. So it makes it difficult for us as consumers to make a choice based on competitive prices. You don't know what your insurance company is going to cover or not cover, what the medication is going to cost. Are there any alternatives? So is there an incentive for these providers of health providers to lower price to compete? Not necessarily.
It's crazy to me because we think of things recently, the Ticketmaster antitrust laws that came about, right? And I don't know the whole conclusion of it, but it all of a sudden hit me. I was like, how come we have these larger insurance companies? How come we have these larger hospitals across the nation? It's not just here in our backyard. Delta Dental specifically here, and we can save Delta as a whole. How are they slipping underneath the radar that this is not? How are they still able to they are fixing prices because they have a monopoly on the market. Everything that you're saying, there's not this transparency, and they are practicing healthcare without a license and denials and arbitrary rules and downgrades. Even for myself, there's a shortage for one of the medications I'm on, and I have to pay for the brand name one. Like, why? That's not my fault that it's out, right? And so it's just all these different things that we don't know what's going to happen on the other end. And that's increasing this margin for accessibility. I'm fortunate enough that I can afford that medication that I need. Not everybody is.
Absolutely. And, there's certainly a good argument for insurance companies practicing medicine because they are largely dictating what people need. And so if there's a better medication suited for an individual and they don't cover it, well, they may have to choose something else. And really, the doctor should be dictating the best treatment for the patient. So, there's a lot of arguments why healthcare is insulated from antitrust laws or maybe even exempt. And a lot of it has to do with the nature of healthcare, how unique it is, and really how some of these things move it away from competitive marketplace. So when you think about it, one thing is government regulation is going to replace traditional market forces. So healthcare is very, very highly regulated, federal, state, local levels, professional regulations that license and discipline professionals to make sure that it's safe standard of practice. States are setting prices, right, reimbursement rates for Medicare and Medicaid. And a lot of this might impact private insurance. They may use those prices as a benchmark. Healthcare providers are likely negotiating higher fees to offset maybe some of the lower reimbursement rates. So the state has a huge presence that can influence some of the pricing. So it can also set prices on medication. There's access mandates where they can require professionals to work in an underserved area for loan forgiveness. A lot of these things, the goal is to make it more affordable and give more access to care. And at the expense there really is pure market competition that could potentially lower rates for us as consumers. So we're also dealing with an essential service that's crucial for public health. So antitrust enforcement really has to balance promoting competition with ensuring essential services are accessible and affordable. Another big thing would be the consumers are pretty limited in their choices. So we
Mm.
have over half of insured people are getting their insurance through their employer. So they're
Yeah.
really not choosing an insurance plan based on competitive factors. There's a lot less influence on the market. And
Yeah.
so again, we talked about the transparency of costs, and also providers are forming networks. So consumers aren't really making as many choices. The referrals are going to specific people. So there's a lot of unique forces here.
I've read a lot of the CMS guidelines in regards to that as well too, for which is the Center for Medicare and Medicaid Services, for anybody that doesn't know that. And it's absolutely something about that accessibility to care and this opportunity that you have larger corporations and larger insurance companies that they're giving these breaks to other larger corporations, right? So we have, for instance, Corewell Health has Delta Dental. We have Hayworth here that has Delta Dental. So they're going after these really, really big ones and making it affordable for them, while a lot of these other smaller businesses are struggling, right? Like they're not getting it. And that's why we see a lot of these smaller businesses that go off and they might use Emeritus or some of these like lower insurance companies. But again, like I have to tie it back to how, with how much regulation that we have in healthcare, how come there isn't more focus and a scope on this part of it in insurance and accessibility? How come one large health organization like Corewell can just go ahead and buy up everything. Now they're part of, they took in Beaumont. And I would have to believe that's more than half of the state's, large health organizations.
Right, absolutely. Well, one of the antitrust laws, the Sherman Act, addresses monopolization and attempts to or conspiracies to monopolize. So, having a large business or even a monopoly isn't inherently illegal. It has to be acquired or maintained through some anti-competitive conduct. So, you have to be big and bad, meaning you have to do something. There's conduct involved. So, um, an example, we went to Corwell. Um, they merged with Spectrum merged with Beaumont in Detroit, and it was reviewed by the FTC, and they found that they really aren't direct competitors because Spectrum is out in Grand Rapids and Beaumont in Detroit. So that merger itself, they determined wasn't going to negatively affect the market. And so there's plenty of justifications, cost efficiency being one. So with economies of scale, they can reduce operational costs. So ideally, they're passing savings on to consumers in some way. Whether that's effective or it actually happens, there's a lot of mixed data on it. I have seen that some of these mergers actually lead to increased prices. So they have better access to resources. They can negotiate better rates with insurance companies, just more bargaining power. So, and then the trade-off is there is reduced competition. Does it incentivize them to engage in some more monopolistic behaviors? There's less competition. Why would they keep prices low if they don't have to? So,
So what is the like? I mean, I can hear you as far as like they're not direct competition because one's on the other side of the state and such. Is there money on the government level to like let some of this, or I mean, do you think anyway to let some of this kind of just like slide on by?
that's a good question. I don't know. Or don't want to comment. So
Yeah. Well, I
I
mean,
don't know.
it's like it's one of those things of like you can't help but think that there's so much money in, big pharma. You look at somewhere like Delta Dental, and I'm trying to put a presentation together for next week speaking event. And it's like between 14 people salary, right? Like, and the other compensation is in the like millions and millions of dollars. I want to say it was their top wages came out to like $128 million. With one of them the CEO at 11 million, right? Like, how is this not part of this consideration and lose decreasing prices for it? Because they're increasing this margin. The auto adjudication process alone, right? Like it's an AI machine meant to deny claims, and in patients, they take that information, they want to blame the doctor for it, right? The doctor's supposed to know all these different things and stuff because the insurance has this message that continues to go out to them is that they need them. And you have Priority Health that's owned by Corwell Health, which again, too, it's like how many people have raised red flag on this one at all? Why isn't this part looked at for a antitrust law?
Sure. I think the Delta Dental antitrust litigation in process right now sort of touches on some of these issues, and there's a class action suit amongst dentists against Delta Dental, and they're claiming that there's a coordinated agreement not to compete. So the way Delta's set up is each regional business is its separate independent entity, and they all sort of operate under this Delta Dental umbrella. And
Yeah.
so the argument is that they're reducing the competition because you have these independent businesses deciding to stick to a specific region or market. And so they're dividing the marketplace into exclusive territories, and they're claiming that they're fixing reimbursement rates below market levels. And so I think Delta has a lot of wrong arguments against that. They have a legitimate business model. They're trying to improve efficiency, risk management, to provide affordable dental care. And then I think one of the big issues here is insurance regulation is a product of state-based regulations. So there's different laws, licensing requirements, and market conditions between the states. And so a good argument is, well, the way they have it set up is a natural result of how the laws are set up and how regulations are. And until recently, there's actually a insurance companies were insulated from federal antitrust laws, and that was repealed for health insurance companies in 2021. So it was for a long time, it was based on state regulation, and I think the insurance companies have just grown so much, it needed to be subject to federal antitrust laws.
So, as far as the antitrust laws go, and I get it, like there's a whole bunch of dentists that's coming together to challenge that with Delta Dental. But as a whole, is there something like patients, how they can, like, is there reaching out to the representatives? Like, how are like complaints processes, if you know anything about that, that patients would be able to take as well too, because they all talk amongst each other. Every single one of us, you and I are patients, and I have no idea the next time I go to the doctor's office what my co-payment's going to be or what treatment. I mean, there's a couple of years ago, I went in for a procedure and they gave me the codes. I had to call to see if it was going to be covered themselves, right? Like, I know how I fight back, but like, do you have any feedback on that? Like, how do we raise a red flag?
Well, I think, there are appeals processes for patients, if there's a limited coverage or direct appeals. I don't know exactly how effective those are or if they're working at all. So, there's certainly state insurance departments that regulate insurers and handle complaints. So complaints can be made to the state. Again, it's hard. They're big,
Yeah.
they're hard to fight against. And so, a big antitrust concern would be maybe how providers are responding. So if there's they call it a group boycott, and it's illegal per se, they say under antitrust law. So if you have multiple providers saying we're no longer going to contract with this insurance company, trying to force a policy change, that's a clear antitrust violation. And you're right. I mean, the people in this market, healthcare providers, they are close. I don't know of any group boycotts, but certainly seems pretty reasonable.
Yeah. What is the worst thing that could happen if there was like a boycott? Like, because it is, I think we hear about the antitrust laws. I know for me, when I was served a cease and desist by Delta Dental, I had speaking engagements that were canceled because there was this huge fear of me talking about it, that there would be pushback because associations are made up of licensed doctors. And so what is the worst thing that ends up happening if a doctor is like, hey, we should get together. We should be saying something and causing a ruckus.
Sure, absolutely. I mean, that's when we could have antitrust laws come into play here. So a group boycott is, like I said, it's per se illegal. It's typically when there's anti-competitive conduct at play. There's really two standards. One is per se illegality, and that's if there's a group of actors engaged in conduct that's so inherently harmful, there's no justification for it. The analysis really stops there. That's an antitrust violation and could be subject to big fines, big penalties, sometimes as much as triple damages. So if you have a group of doctors doing this, they're certainly at risk. And so there's civil complaints, criminal complaints. There's really a lot, at play, and it's tough. It is tough. So I think and maybe you have more insight on this, but a lot of providers maybe they're not negotiating fees as much as they should be with insurance companies. And so
Definitely.
I think there's some issues there. So yeah, the group boycott is a huge issue. and I'm not aware of anyone doing it. But like I said, healthcare providers are close. I don't know. I'm sure they're talking, whether they're coordinating it or not. I have no
Yeah.
idea.
I mean, I don't really think so because they're all scared of it, right? When you talk about how much trouble that they could potentially get into and, those types of damages. I mean, even for myself as just like one person in West Michigan, like you said, in that cease and desist, like that was immediately like what I thought, they're going to shut me down, right? Because they have a lot of money in it. And it's really, really quite terrifying. And so doctors coming together, and even then, when we have some of these, they can't come together and like try to do price fixing or try to demand different contracts or anything else like that. But can they come together for a legitimate case to push back to change antitrust laws as a whole, right? Can they push back and say, hey, I'm not saying we need to have $100 for this because we're getting $80 right now and we want that now. So like,
Yeah.
okay, I understand antitrust laws with the doctors coming together and they can't try to say like and demand that, this boycott of like, we're all going to leave unless you give us X amount of money for, the procedures or whatever percentage increase. But if they were all to kind of join together to, I mean, push back, right, on the insurance company to make real change in regards to how insurance companies and their auto adjudication processes, say, for instance, they came together and said, this can't happen anymore. I know it's efficient on your end, but you can't have a computer telling my patient what they can and cannot have. Would that part even be considered antitrust?
Sure, absolutely. So antitrust laws protect the market, anything that would restrain trade. So, lower fees. They're preventing others from fairly competing in the market. And I think this class action suit going on right now is really a push to change some of the policy, maybe reshape the laws a little bit and to push back on this. And again, it's hard because the providers are usually small individuals who don't have a lot of bargaining power
Yeah.
versus larger insurance companies. I think the result of this class action suit is really going to shape some of the policies moving forward. And I mentioned the insurance companies now being subject to federal antitrust laws. It's been 3 or 4 years. I don't know exactly how that's affected in a positive or negative way, but I think that's going to help change the policies as well, at least keep them in check. Um, so we'll see. I think it's new, but in general, I think if we're limiting insurance companies to, or at least subjecting them to the federal antitrust laws, we're in a better place. And the goal was to hear better pricing for individuals, give them more options. And we also sort of discussed how people are getting their insurance through their employers. So again, there's just a lot of unique market factors, that a lot of different layers that play into this issue we have. And
Yeah.
it's not just the big actors. I mean, this is maybe a systemic issue instead of one bad actor. And I think that plays into the Ticketmaster thing. um, that was I know you mentioned that, and sorry to keep jumping around,
No,
but
you're right. Yeah, I jump around all the time.
the Ticketmaster issue was very upfront, very public. And I think with healthcare, like I said, it's seen as a systemic issue. With Ticketmaster, you have the Biden administration came out and wanted to enforce antitrust laws more strictly. And also, this was a very public thing. You have Taylor Swift commenting on this issue because she has a lot of power. She does.
Yeah, I mean, yeah, it's true.
And you have consumers contacting their representatives about this. And so there was a big public movement, and I think they're able to point the finger at Ticketmaster and say, this is a bad actor here versus the healthcare industry. Well, we have a whole systemic problem. Who's at fault here? And I
Yeah.
think that is a big difference in the two industries and how the antitrust laws are applied.
Yeah. I mean, there's so many webs that this could kind of like tentacles of conversation draw this around to. And so I'm so appreciative of you at least like letting me know a little bit more about antitrust laws, because I can look at some of that stuff all day long, and I read enough like already like healthcare and CMS manuals that I don't want to add on to like some legal jargon that I have no idea what it's saying. But it certainly helped build some clarity to me. And I definitely believe any listeners is going to have that. And so I'm thankful for this episode. And we're going to have you back though, because I want to talk about, not just here in like West Michigan, very specifically about the lawsuit in cases that are going within dental, but huge mergers and opportunities. And what is your take on health organizations owning their own insurance company and how like the continued growth of private equity across the nation? So I'm going to have you back. We have to give this cliffhanger so we can make sure that people come on back and talk about it. So again, thank you so much for letting us know about antitrust laws. And yeah, I'm going to see you again.
Absolutely. Thank you very much. Appreciate it.